Hi, this is Jen, Thomas, and Kayla, and in our video we're going to be showing you some interventions to improve standing and standing balance as well as locomotion. So stay tuned, here comes the first one.
The first technique we'll be showing you is modified standing holding.
The goal of modified standing holding is to minimize postural sway and to maintain prolonged posture. So the first one is going to be active holding, where your hands are on the pelvis of the patient and their fingertips are on either the plinth or table, whatever you're dealing with. And again, you're looking for the minimization of postural sway and just to make sure that they have good posture and in a prolonged standing. The second one would be resisted holding. So this one, you're going to use the stabilizing reversal technique. So what I'm going to do is I'm just going to put one hand on the back of Kayla's trunk and the other hand on one side of her pelvis, and I'm just going to say, don't let me move you to your left. Good. And then don't let me move you to your right. Good. And then I'm going to say, don't let me move you forward. And don't let me move you backwards. Good. And then the last one that we would do is rhythmic stabilization. This is for the flexors, extensors, and rotators. So again, you're going to have one hand on the pelvis, and the book says to have one hand on the anterior trunk. So the hand placement's a little weird. Mm-hmm. So anyway, we're going to try up here on her shoulder. So don't let me move you. Good. And don't let me move you. Excellent. Okay.
So what we're doing here is we're going to be working to have the patient weight shift a few times, and then we're going to progress into a stepping motion. We're going to be using
dynamic reversals.
The cue on the side here, and then we're going to use an NDT for the anterior thigh here. So what I'm going to say is push into my hand, keep on push, going back to the center. So weight shift and push into that left. There you go. One more time, push again, good. Come back, and then this time when we go, we're gonna weight shift, and then we're gonna try and step this anterior thigh forward. Okay, so weight shift into my left hand, push into my right hand, push, 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 keep on going, there you go. That's okay. Good, and let's weight shift to our left again, and then come on back. Good.
So now that we have our patient in a staggered stance and we've done a little bit of balance work, we're just going to continue and progress balance work. So for this one, we're going to use stabilizing reversals, and we're going to use rhythmic stabilization technique. So first one, stabilizing reversals. I'm just going to be on one side of Thomas, hand on the pelvis, the other hand on the shoulder. Don't let me move you. Don't let me move you. Good. And go ahead and switch feet for me. And now other side. Same hand placement. Don't let me move you. Don't let me move you. Don't let me move you. Alright. And now we're going to prevent anterior posterior motion. So hands on the upper trunk, pelvis. Don't let me move you. Don't let me move you. Good. And then preventing posterior. Don't let me move. Don't let me move. Okay. And then for rhythmic stabilization, same thing. Why don't you switch feet, Thomas? Okay. And hand on pelvis, the other hand on the back of the shoulder. And don't let me move you. And switch. Why don't you switch feet too? Just so we can show everybody still move you, and perfect. And the hand placement and the input that you're getting from the patient will allow you to determine how much pressure to put so they don't lose their balance.
Next, we will address functional skill of locomotion by ensuring the patient is able to ambulate independently with appropriate timing and sequencing of motor movement components.
In this example, Kayla is using NDT techniques to encourage reciprocal arm swing as Thomas improves his motor skills in locomotion. Okay.
So you would instruct a patient to step with their right, step with the left, step with the right, and step with the left. Good. Perfect.
Next, we're going to utilize sidestepping, which will help to ensure that the patient is able to ambulate independently using complex stepping patterns. This is going to be a precursor to braiding, which is a little bit more difficult for patients.
Sidestepping is used to facilitate lower trunk rotation, pelvic and lower extremity patterns in combination with upright postural control, and to promote protective stepping strategies for balance. First, we're going to be utilizing dynamic reversals to assist with sidestepping. So I would stand beside the patient, my hand would be on her hip, and I would say push into my hands as you take the step with your right foot. Take the step. Good. Push into my hand and sidestep. And good.
So a precursor into braiding would be a step over. So with Kayla, again, you would use the PNF NDT technique of dynamic reversal. So what I'm going to do is I'm going to have my hands on the side of her trunk and using the same cues before, so push into me. Now lift your right foot and bring it over and set it down. So she's actually utilizing the D2 flexion PNF pattern as she's bringing her foot over. And go ahead and step back for me. The last thing that we wanted to show you is resisted progression. This is a great technique that helps facilitate trunk, pelvis, and lower extremity motion. And its positioning is where the therapist is in the front or anterior to the patient. And this is great for our patients that maybe lack a little bit of stability and balance.
So you're going to step with the right. Let's go. And what I'm doing here is making sure her pelvis is stabilized the whole way. So picking up as they go, just like that. Good. And then making sure they're not over, going back and forth, and they're lifting up and down at the same time. Push, push, push. Good. Now we're going to go the other way. Push. And then the other way. Push. Good job. Push.